So, what are the possible strategies to achieve this? Reduction of content overload, of course, very important. Need to employ a range of teaching learning methods, developing study skills, use of technology, medical humanities. Those are the areas that I am going to touch upon. Reduction of content. Are we putting our student in such a thick wood so that they fail to see the bare bones, the trees within the wood? Do we need to reduce the content that we teach? I think yes. Based on the objectives, outcomes, and integrated approach will go a long way in reducing the content overload. And more application-based, practice-based, and relevant. So you can focus only on the relevant and the practically applied areas when you are teaching them. And promoting student-centered learning through study guides, e-learning, so on and so forth. Employing a range of teaching learning activities so that it will cater for the different learning styles and will try to stimulate the different components of brain as the neurosciences would suggest. More focus on student-centered learning, more interactive, and contextual learning is very important. Creating a conducive education environment. Community-based education, clinical settings will go a long way because when it comes to health professions education, that would be the learning in the context. Learning environment, basically it means everything that is related to learning. The infrastructure, the staff, students, social life, everything. And learning would be best in non-threatening environment related to the learning. That is context specific. That is why in health professions education we need to focus more on community-based education as well as the clinical learning because most of the patients are actually in the community. Now, this doesn't seem to be very interesting though, even though there are some other interests as well. Clinical teaching, I think many of us would agree that even now many medical students and health professions in that are taught by a system of negative reinforcement. Do we need to change that? Do we need to promote more conducive learning environment and more welcoming learning environment for the students? A range of teaching learning activities which are very interesting are available. Seminars, role plays, debates, dramas, and games. Even areas that are very complex like immunology could be taught using certain games. So there are a huge buffet of interesting teaching learning methods available. Study skills, again, since this is so challenging, we have to equip our students with the necessary tools. The fast reading skills, the SQ3R technique where the student can go through a document or a chapter very fast using an overview method. Listening skills, note-taking skills, Cornell method. Summarizing information like flow charts, mind mapping, again very important. Those are very important and practical tools that we need to equip our students with. Mind mapping, again very interesting. When you go back to the contextual learning and the constructivity theory, the schema activation, what is meant by mind mapping is how information is diagrammatically, pictorially arranged. The exact way the information could be arranged in our brain. This shows the different linkages between different areas. This could be a very effective learning tool for information storage and retrieval, especially when we are to deal with a huge amount of information. So, mnemonics, another area. Again, the reality is health professions education, a huge amount of content load is there. So even strategies like mnemonics could be very useful in relieving the memory burden that the student will have to carry. Usually, mnemonics are short, simple phrases to facilitate memorization. For example, PAD, palmar adductor, scalp, to remember the layers in the scalp. There are many other examples. Ideally should be understandable in the local context because the student might not be able to understand what is there in the other cultures, so on and so forth. Sometimes certain dirty mnemonics could be remembered, but I'm not going to go into details. There's so many in there. This could be one. And also, since health professions education content is so complex, can we use simple generalizable models to understand simple concepts? The vein artery nerve relationship, or in the human body, there are so many triangles. So the same principle of a triangle with borders, floors, roofs, and content could be applied for any of these triangles. So is there a need to go for those simple generalizable models? One thing we cannot forget is our kids nowadays, they are in the Web 2.0 generation. They are the digital natives, unlike many of us who are either digital aliens or settlers. Online learning could go a long way in facilitating student-centered learning. Simulation, mobile learning, all these things, because we cannot move away from the reality of technology, that is there to stay and it's going to have more and more expansion. Distance learning, online learning, simulation, that is because the number of patients are limited and because of patient safety issues, simulation will have a definite role in future training of health professions. There could be very sophisticated mannequins like this, or even low-cost simulation could be there. That could be another approach. Medical humanities, again very important, a neglected area. Can we use movies, videos, art, drama and theatre, stories, books to arouse interest and motivate our students? There are several very interesting movies, Patch Adams, which shows about a doctor with humane qualities, House MD, the doctor, so on. There's a huge list which we could use to basically teach the empathy, communication, palliative care, those difficult to teach areas to our students, the challenging areas. And that will arouse the interest. And there are some films and teledramas in Sinhala as well. There was recently an oration by Professor Nimal Senanayake, who very eloquently illustrated the use of teledramas in teaching mental health. Movies and videos, a lot. And art. Vincent van Gogh, the famous Dutch artist who himself was suffering from bipolar disorder. So those could again be used in teaching our students so that the teaching would be very interesting and motivating. Even our own Henry Jayasena, Balagilano, the story of his own story of a cancer patient, could be used to inculcate empathy, communication, and the feelings that a patient would go through. Stories. Can we use stories, the Greek mythology, the Medusa and Caput Medici, or maybe the Achilles and the tender Achilles, so we can basically arouse interest before we give the hard facts to them. So in summary, we need to go for an integrated learner-centered outcome-based approach, meaningful learning based on the relevance, context, and the application. We have to motivate the learners and facilitate their interest. Schema activation, that is the well-arranged, classified arrangement of knowledge within our mind, and appropriate use of technology and facilitation of learning skills. With that, hopefully we should be able to achieve a final outcome, that is producing a graduate with knowledge, skills, not only that, attitudes as well. Thank you.
Thank you, Indika.